Jasmine, if you want to make sure that we can record this just so we have it. And with that, Dr. Kasirye, I'm going to turn it over to you to give us a little bit of a lay of the land on where we stand for both all things COVID, but specifically on some of the vaccine rollout.
Sure. So real quick, with the numbers, we have over 89,300 cases reported right now and over 1,300 deaths. The good news is that the numbers are continuing to go down. As of this morning, we had 264 additional cases reported, which is a drop from, if you remember, in December, we actually got to the point where we were having 1,000 cases reported in one single day. So that is very good news. Our case rate is going down, and we're still in the purple tier because it will take us a while to get to 7 per 100,000, but we are heading in the right direction. And also with the hospitalizations, the number of people in the hospital, it's in the 200s. So it's 50% of what it was a couple of months ago. And even ICU, and even in talking to the hospitals, they do state that they're seeing a reduction in the number of cases that are showing up for COVID-19. Recently, and I'm hoping that you're all familiar with our dashboard, but recently we did add a new tab to it just to highlight that for you. That shows the vaccinations. We've of course had a number of requests from different people wanting to know how many we've gotten, and the administration. Part of the delay that we've had, sorry, there was a little bit of background. So part of the delay that we've had with being able to provide these numbers is that we're reporting in different systems at the state level, and being able to match the numbers in the different systems has been a little bit of a challenge. The state is working on that. So the numbers are going to change, but we're hoping to be able to update our numbers on our dashboard on a weekly basis. So as it stands right now, and these are numbers from last Friday, so they'll be updated tomorrow, is 138,225 vaccines allocated and 114 administered, and 80,992 of those are in people who live in Sacramento. One of the questions we've asked is, why is there a difference between total administered and Sacramento County residents? And that's because we have people who live in other counties but work in Sacramento. And right now with the way that it works is that we will vaccinate people in the sectors that we're vaccinating, people who either live or work in Sacramento County. So that's why there is a difference. So just to explain how we get our allocation, the federal government initially takes off an allocation that goes to the pharmacies. And initially it's been for them to be able to vaccinate the residents and workers in long-term care facilities. And then after that, they give an allocation to the states. And so for California, once they get their allocation, they take off a certain percentage for the hospitals, or call them multi-county entities. And these are the larger hospitals. And Sacramento County happens to have 4 of those. So they get, but the allocation is at the corporate level, and then they decide how much is going to each of the counties. And then about the 70% of the allocation for California, then it goes to the counties. And so the way that they make their decisions on allocation is based on which sectors we are vaccinating and what the percentage or the number of people in each of those sectors for each of the counties. So for now, we've been vaccinating healthcare workers and just started phase 1B, which does include first responders, teachers, agriculture workers, and then people 65 plus. Lastly, about the phases, the state started off with a certain prioritization, but over time that has changed, and we've had to try and keep up with that. So at one time we had the phase 1A, which was healthcare, and 1B, which included emergency workers, and then 1C would include other essential service workers. But the change was made recently that they want to go to an age-based prioritization. And explanation or reasoning for that is because when you look at especially severe cases and deaths, it does increase by age. And so people over the age of 65, if you were to go on our dashboard and look at our numbers, 80% of our deaths are in people over the age of 65. So it does make sense to be able to focus on that. But that does leave us with the question of, once we get through tier 1 of phase 1B, what is going to happen? And just to let you know right up front, the guidance that we have right now is that we will go to an age-based system. So we are trying to talk to the state and ask if we would still have the capacity or ability to vaccinate some of the essential service workers, which is probably a lot of the people on that you represent on this call. So that's where we're at. We haven't gotten a clear response on that, but I guess I'll stop there and see if you have questions.
Thank you for that, Dr. Kasirye. And we do have a few questions we've had folks submitted previously. Maybe again, just to follow up on what you just shared. And I shared with everyone the PDF document that you guys have put together, this great checklist of like, who's next on the list. You know, 2 questions related to it. One, it sounds like in the current scenario, it is 65 and over, and then you are now moving into law enforcement, emergency services, and possibly next teachers and childcare on that list, as far as whether you're 65 or not. But the concern is that based on the guidance, the state is saying that may change and just be purely age-based. So in essence, if you fall under 65 in one of those categories, do what you can to get the vaccine now before that changes. Is that a fair assessment?
Yes, after and we don't know when they will make that cutoff. Right now, they're still allowing us to go through phase 1B tier 1 because they are aware that it's a large group, and you know, by especially some of the sectors, like if you look at the agricultural sector, it actually does include the food industry, like restaurants as well. So it is a large list. And we are starting to look at that and see how we're going to address that. So, and as probably sometime in March, we'll be going towards being able to start vaccinating the agricultural sector. But after that, if the state gets to the point of saying, okay, everyone now you're going to do it by age-based, it will be regardless of the industry that the person is in. I guess what would be next would be those, I believe it would be 50 to 65 or 50 to 64 that have chronic conditions, and I don't know how many will belong to that group, and then we'll move to the next one.
Dr. Kasirye, also, and again, just for us, we deal with obviously with a lot of employees and employers. What again is your best advice as far as if you are eligible, so one, you've identified you are eligible, is the best advice to first contact, if you have healthcare, to contact your healthcare provider and to find out where they are offering it and to go through them, whether they send you to a Rite Aid, a CVS. Should you go first and register through the county, and then the county tells you where to go, that is best? What is like the I will say the first and the second and maybe that third, scenario of where do you go to first register to sign up for that vaccine if you are eligible?
Right, and also actually I forgot to mention when I was talking about the vaccine allocation. So we get our allocation weekly, and so Sacramento County in the last few weeks we've been getting about 15,000 doses per week. Sometimes it's less, sometimes it's a little more. So we are able to set up appointments only on a weekly basis because we don't want to set up appointments only to find out that we're getting a lot less and then have to cancel, because that makes people very upset. But again, with that allocation, there's not enough vaccine for everybody. So that's part of the reason why there's been a lot of concern and a lot of anxiety, especially for those that really want to get the vaccine. So what our advice has been that one, first check with your healthcare provider, because especially if your healthcare provider happens to be Kaiser, Sutter, Dignity, or UC Davis, because they're getting their own allocation and they're able to give vaccination not only to their own staff but also to their patients, that would be a good place to start. But of course, we're hearing that it's a challenge getting through those systems as well, because of course the systems are overwhelmed. So the next step would be that, especially for the occupational sectors, what we've been doing is when we get to a certain sector, for example, I'll give an example of the physicians. We've been working with a contact person. In this case, it would be the medical society. And so we send links to the contact person, and then that person will send it out. We're doing the same with, now that we're starting the teachers section next week, is that when we have clinics set up, that we'll send out those links for registration to the contacts, and then the contacts send it out to the teachers and school staff, and then they're able to register. And the reason we're doing it that way and not making it public is what we've learned is when it goes public, is there are a lot of people who are hunting around. Even in fact, one time one of our links was leaked to social media, and we had people from Southern California registering for our appointments. We had teenagers registering for our appointments because the system we're using does not limit by zip code or by age or by sector. So we then have to go through and make sure that actually the person does meet our criteria. Otherwise, we have to go in and cancel that appointment. So this is the best way for us to be able to make sure that the links are available to the people who should be getting them. And then for the 65 plus, our healthcare partners have been helping a lot with that. As I mentioned, the healthcare systems have been getting their own allocation, and they've been focusing on the 65 plus. We're also hoping to open up additional sites and we also have pop-up sites where we're able to offer this vaccine.
Thank you for that, Dr. Kasirye. I know one of the questions we have right now in the chat, and I'll ask for you, Michelle, but by all means jump in here if you have a follow-up or need additional information. For the system for folks to be notified, if somebody misses an appointment or additional vaccines are available, do you have a wait list or way of notifying the next people on the list that might be waiting? We've been hearing of multiple scenarios, kind of what you just addressed of people are registering on multiple sites or multiple locations, and then they don't show, and then there are extra vaccines available. So is there a notification system, or two, is there any information related to that this group should know about?
So we do have a wait list, but right now I think we have maybe 10,000 or more people on that wait list. So it's and usually we have only a few doses left at the end of the clinic, because the people who are signing up really want to be there. So we have very few no-shows. And the other also is that because they have to register ahead of time, we only have a certain number of vaccines on site. So we don't have people just walk up or drive up to any of our sites, which I guess in some places people have been doing that. We discourage that because likely we're not going to be able to get to them. We may have maybe 3 or 4 doses that are left at the end of the day. For the hospitals also, I think what they've been doing for their clinics is, especially because many of them for the public are pop-up clinics, is that they will just try to get somebody close by. I don't think they have a running list of or waiting list for individuals to sign up. I know that some of the counties tried that, setting up a waiting list, and their systems just crashed because so many people were trying to get on. So I think it's not probably the easiest way to be able to get vaccinated if you're putting your name on that list.
And Dr. Kasirye, you brought up again, and maybe this is more with some of the private providers, but because of the concern and people want to make sure every single vial gets used and every single dose gets used, that they're having people showing up at sites essentially waiting in their cars or standby, that if there's even one extra dose, someone might be able to use it, even if they don't qualify under the 65 and above or the other categories. Is the county, I know the county is discouraging that, but is there any, again, advice you can offer to that? Or is that something, how are you guys working with that if there is extra doses at the end of the day?
So the wait list that we have is actually still people who would qualify with the, or who is eligible based on the tiers that we're vaccinating. So it's just that maybe that person has not been able to get through, but they will put their name on the list just in case an appointment comes up. So we try to limit it, or try to, because the other thing also is we do have volunteers that are assisting us at some of these clinics. So sometimes it's the volunteers that get the opportunity to get vaccinated that way.
Okay. Michelle, let me know. I'm hoping that answered your question.
Yeah, I did actually. Thank you. I'm glad to hear that. It's probably just rumor mill that you hear that they're throwing away dozens of vaccines, and so it's good to know that people are showing up and the shot's getting into the arms of as many people as it can.
So I think Fred from the Rainbow Chamber has a question. Fred, do you want to address?
Yeah, thank you. First of all, Dr. Kasirye, thank you for all you do, your staff. I know it's a challenging job and it's constantly moving, and you're getting so much information just sent to you, and not to mention death threats and staff issues and all kinds of stuff. So we all applaud you for your work very, very much. I have a couple of questions. One is a little bit simple. I heard a report yesterday that they are suggesting that you use smaller needles, which would allow an extra dose to be taken from that vial and extend that vial to have an extra dose. So my question is about the supply chain of that. But my bigger question is, all of us here are humans first and foremost, and we care, but we're also business folks. So we have to really, fight for our business interests and our city and taxations and all that fun stuff. So my question is a little bit bigger. With all the outdoor structures that have come up for outdoor dining, there was some guidelines for those outdoor structures. Me as a human, my business hat and my human hat are different. I certainly would love our businesses to run, be open, generate revenue, do everything they need to do. But as a human, I'm really concerned about some of those outdoor structures, and the guidelines weren't really specific at the beginning. A lot of those businesses spent a lot of money building an outdoor structure, and they're not quite appropriate. And then with that, I know you don't have a magic answer, but we're all questioning and worried about this new variant and the variants. There's several of them, as you know. And I'm not really sure how that's going to affect continuing our businesses and how businesses operate with indoor, outdoor dining, or the guidelines for the outdoor structures. Should we be doing a little bit more worrying or guidelines to our business members and how to move forward?
Thank you. I had to write down so that I remember all of your questions. So starting off with the extra doses. So thank you for bringing that up. So what and this I think pertains more to the Pfizer vaccine. So when we were getting the dose, the vials, it comes in a vial and it's supposed to have 5 doses. What people found out, or the vaccinators found out as they were drawing the doses, because it's supposed to be a number of milliliters that you draw up, is that if you used a certain type of syringe that didn't have a lot of dead space, that you actually ended up with 6 doses from a vial. And actually, that's part of what sometimes ended up with people having some extra doses. Not a lot, but it was happening frequently enough that now Pfizer is changing, and the default will be that you should be able to get 6 doses. So it's not the needle, it's the syringe that is used. And this actually, when we get our shipment of vaccine, they also ship the needles and syringes with it. So they're going to add an extra needle and syringe with the expectation that you should be able to get 6 doses out of each vial. But it doesn't always happen. So I think they're still working with the technicalities of what that means in terms of if you're not able to get the 6th dose out of that, how to account for it. But that's where that comes from, about the extra doses. And then with the structures, I don't think I have anyone on the call from environmental management. They take the lead with being able to help us with, because normally they're the ones who oversee restaurants, and they've been doing inspections with restaurants and giving some guidance on some of the structures. So if there are structures that you see that seem to be, questionable and might not be safe, if you're able to send that information over to environmental management, they've been very diligent in going over and being able to talk with the business to try and help them to be able to get, make changes. And of course, knowing that a lot of money has been spent on some of these structures, we're very cognizant of that. So just look, our goal right now is to see how we can help people to meet the guidance. And yes, you are right that initially it wasn't very clear what people needed to do, and that's why we have these structures that might not meet the guidance. But now I think the state did provide better instructions or guidance on that. So hopefully that's happening less and less. And then about the variant, yes, we are concerned. And that is part of the reason why we're continuing to tell everybody that we shouldn't let down our guard. Yes, the numbers are reducing, which is good, but because there are these variants that are coming up, and sometimes it's difficult to know when it's in your within your vicinity. I think recently we did get notification that one of the variants had shown up in our neighboring Yolo County. So of course that is concerning for us. So that's why it's important that we continue to be vigilant in using face covering, social distancing, avoiding the gatherings. And just wanted to note also that, because sometimes people ask themselves why these variants do come up, this is the nature of these viruses. And actually that explains why with the flu vaccine, we have to have a new one every single year, because the influenza is also another RNA virus that keeps changing and adapting and trying to slip through and avoid our defense mechanisms. So that's why it's important that our labs are able to have the capacity to check for these variants. Right now in California, it's only the larger labs that are able to do it. We don't do it locally in Sacramento County. So if we were to suspect that someone has one of those variants, we would send it to the lab, the state lab, to be able to make that determination.
Dr. Kasirye, two of the questions that came up. One is on just the immunity that's being built, and we'll just, for right now, in the context of the current variant that we're seeing in our region, as a trusted healthcare professional, can you again share with this group? I've talked to multiple people, including like my own parents, and they're like, "Oh, I got the vaccine," and they got their first dose, and they're like, "I'm immune," and we're hearing more and more about, how much immunity is being built. Obviously, I think we're all very aware of the importance for the second vaccine. But again, as a healthcare professional and living this and breathing it every day, what is the belief of the immunity that is built after the first vaccine? And then can you also share what you guys are doing to ensure that those that now can get the second vaccine are being able to schedule and have access to that?
Thanks. So if I could back up a little bit and explain a little bit on how the vaccine works, because those are some of the questions that we've been asked before. There was a lot of concern at the beginning that, oh my goodness, how come they were able to get a vaccine so quickly? Just to note that this technology, even if it's the first time that we're using it for the vaccine, they had been working on it for a long time, even starting with Ebola. And so it just so happened that it came together really well, that as when they were able to identify the virus, that they were quickly able then to use this technology to be able to develop the vaccine. But no shortcuts were taken. They did do all the steps of doing the different trials with different groups, and those groups are still being followed up to now. And that's where we get the numbers about how effective the vaccine is. So just real quick, the way that it works, and you've probably all heard that it uses what is called a messenger RNA. And RNA is a substance that is normally found in your body anyway. The way that RNA usually works, it's like it's a message that gives instructions for being able to build proteins. So, and for the vaccine, the protein that is being targeted is called the spike protein. And you've probably seen pictures of what the virus looks like, and you see that it has these spikes that protrude. The spikes help the virus to be able to latch on to a cell, and then it gets absorbed into that cell. So basically what the vaccine does is that they were able to create a messenger RNA that gives instructions to the cell so that the cell is able to produce a protein, produce an antibody that then is able to recognize that protein. So what basically happens is when the person gets the vaccine, because the mRNA is enveloped in like a lipid, or it's a small molecule that then is able to get into the cell, and it then releases the message through the messenger RNA and gives instructions. Okay, this is how you build the antibody. So after it does that, the mRNA gets destroyed, but the cell now is able to recognize and produce the antibody, so that if later on it is challenged, if the virus does enter the body, that it will be able to quickly produce the antibody that will then be able to destroy the virus. Because if the virus cannot attach to the cell, then it can't get in, it can't replicate. And that's how that happens. So from the trials that were done, what we're told is that with the first dose, you get anywhere from 50 to 80% of protection. But in order to get to the 95% of protection, you really have to have both doses. So it takes a while. So I would tell people that you need to give yourself at least 2 weeks from the time that you get your second dose to actually get the full effect of the 95% protection. One of the other questions that we've been asked about is that, okay, now I'm past the 2 weeks. Can I just do anything? Can I stop wearing my face covering? Can I go to parties and do whatever? Not yet, because there's another element that we need to wait for, and that is the herd immunity. Because since we still have the vaccine circulating, I already told you we're still getting a number of new cases every day. There's still a certain level of vulnerability because we're still learning how effective the vaccine is in terms of, we know that it's very effective in protecting the person from getting the disease and getting sick. But we're still learning as to how effective it is in stopping the person from being able to transmit it. So that's why it's important that we still have the face covering, that we take some of the protections that we've been talking about. And so some of the questions we've been asked, especially this comes from the grandmas, is now that I've been vaccinated, can I go and hug my kids? I think it's okay to take steps such as, yes, you can visit, start off with still being able to keep the social distancing and face covering, but you don't need to be isolated in your house as much as you were before. Hope that answers the question.
It does. And then again, going back to that, Dr. Kasirye, how is the county either scheduling those second rounds of vaccines and or ensuring that, I hate to say it, we have the supply, knowing you're also dealing with these new levels for the first round?
That's correct. So initially we were getting, when we were getting the doses, would get an allocation that would be designated for first doses. And then later on, we'd get an allocation that was designated for second doses. My understanding is that they're going away from that because they want us to vaccinate as many people as possible. But what we do is, because we do keep track of who we vaccinated, is that when we comes down to the second dose, you'll get a reminder that you need to schedule your second dose. Some clinics, and some of the health systems might be doing this, is that when you get your first dose, they also schedule you for your second dose. But the system that we're using, you get scheduled for your first dose, and then you'll get a reminder to schedule for your second dose, and then we get an appointment for you. Also, in case people do get concerned, because we do know that it's 21 days for Pfizer and 28 for Moderna, but we now know that we actually have a grace period of about 6 weeks. So if you don't get in on day 21, don't panic. Yes, you do need to continue making sure that you are able to get in, but it doesn't mean that if you get it on day 25 that it will not be effective.
Dr. Kasirye, do you, like, once you have, whether it's the first dose or the second dose, I've seen some people kind of share this or show this, do you get like almost like an ID card saying like, I've gotten my doses,
Yes.
because you're an essential worker and you have to travel or anything else? So that is something you will receive, whether it's from the county or your healthcare provider, once you get those vaccines?
Yes, so actually with the supplies that we get with our shipment, we also get special cards that show that you've been vaccinated. It's almost like the yellow cards that we use for children for their vaccinations in school. But this one is much smaller. It can fit in your wallet. What we have asked people to do, that, yes, people are excited. They're showing it on Facebook. Please make sure that you hide your personal information, because we don't want that to be a cause for someone to have their identity stolen, because it does show your date of birth. And we've heard that there are some people who've had unfortunate events where their information has been taken.
Dr. Kasirye, Fred had a question. I'm going to hopefully phrase it in the right way. And then there's maybe a related question to it. He asked, will we begin to have access to antibody tests as folks get vaccinated? And how accurate are those? I'm going to guess, Fred, this is more in the context of if once you've had the vaccine to show you've built the antibodies. Is that a fair assessment?
At this time, there's no requirement to get tested to find out what your antibody level is. You get vaccinated and that's it. And actually, I wanted to answer another question that I've received also. Some people, it's been floated somewhere that someone was encouraging people that you needed to get a COVID test before you went for your vaccine. No, that is not a requirement. We do tell people though that if you are exhibiting symptoms that you wait until your symptoms have resolved. And if you do know that you have COVID-19, that you wait at least the 90-day period before you get your vaccination. And the reason for waiting the 90-day period is that at least from what some of the information we have received, we are told that for people who may have had COVID-19 and then get the vaccine within that 90-day period, they may get more severe side effects like fever, fatigue. Those do pass off, but it can be uncomfortable for people. So that's why we tell them wait the 90 days and then get the vaccination after that.
Dr. Kasirye, on that note, and we've had a few conversations with Kate Dyer at STEM Express, where she has said like they've seen tests now coming through where people initially were tested positive for COVID, whether they were asymptomatic or symptomatic, and then now months later they're coming back and testing positive again. On that note, I've heard from some folks saying like, I don't need the vaccine. I had COVID. I have natural immunity, right? I don't need to go in and do that. What again is your advice outside of what you just shared on the 90 days that you would give for people that either tested positive or were symptomatic, more than 90 days ago? Do they still need to get the vaccine?
Yes, and the reason for that is that the protection does not last a long time. And in fact, from the studies that have been done, and that's why we have the 90-day, it's expected that if for natural immunity after getting COVID-19, is that it lasts about 90 days. For some, it might last longer, but it's not enough. So you do need to get vaccinated even if you did have COVID-19.
Does the science show right now for the vaccine that at least for this specific variant, you carry immunity beyond those 90 days? I know we still don't know enough yet as to, like you say, there's a seasonal flu vaccine and we'll probably have a new seasonal flu vaccine next year, but at least for right now, is the science showing that you will carry that immunity beyond the 90 days if you have the vaccine?
Yes, it's minimum 8 months, but they're still following up with the people who are part of the trial to find out just how long it lasts.
Dr. Kasirye, maybe one of those other, whether it's a rumor or you can address, we've heard from a few folks that you can volunteer to be at a clinic, and in volunteering to be at the clinic, you can get the vaccine even if you don't qualify under your list that's approved right now. Is that an accurate assessment, whether it's a clinic through the county or otherwise?
I think some of the clinics have done that. Some of the pop-up clinics, we are discouraging that right now, that they really still need to vaccinate only people that are eligible. But I think that there are some people who did get the vaccination that way, that they volunteered at a clinic and got it. The other way again is also if with the extra doses at the end of a clinic, I think some of them have been able to get vaccinated that way. With the one that we run at CalExpo, we still follow the guidance that you have to be eligible. And most of the people we're using are either county staff or we get them through the National Guard, and the National Guard have their own way of getting the vaccine. So we don't have too many of those opportunities for volunteering at CalExpo.
Okay. I'm gonna do a quick time check. We're at 9:50. I know we started a little late, but want to ensure we end on time. I have one more quick question for you, Dr. Kasirye, before again, making sure we've covered everyone who's with us today, whether it's in chat or otherwise. And that is, how are you, like, beyond I think age is one of those things that's easy to verify. You got to show an ID that shows your birth date. But now that we're getting into different sectors and industries, you know, to Fred's comments, when we talk about, you know, getting into ag and hospitality, how are you verifying that people are eligible, you know, especially when this comes to, hopefully when we start allowing, if it's folks in our restaurants, like how do you verify that for folks that are signing up or showing up to get the vaccine?
Yeah, that will be a challenge. For example, also if we are going to, when we get to giving vaccinations to agriculture workers out in the field, many of them may not have the appropriate ID. So it will still depend on trusting what the person is saying. It also helps if we're going through the employer when we are sending out the links, because they're sending it to people who, you know, work for them. And so that, in fact, that's one of the best ways that we've had in order to be able to verify that a person does work where they say they work. But otherwise it could be a challenge, and it might get to the point where we're like, well, if you say that you work at this place, we'll just have to trust your word.
Dr. Kasirye, we had a question that went through the private chat. And I've had conversations with family members in this regard as well, that there are reports of rare deadly blood disease and DNA alterations based on the vaccine. I know this is all new science, and you did a great job earlier of explaining some of it, but can you address those fears of people saying my DNA is being altered, or I'm going to get this rare disease because of the vaccine?
So just to explain, your DNA is all held up in the nucleus of your cell. And when the molecule with the mRNA enters your cell, it remains in what we call the cytoplasm. It does not go to the nucleus, never touches your DNA, has no opportunity to change your DNA, and actually self-destructs after it gives the instructions for building the antibody. So there should be no concern about that. The other question we've been asked is there a microchip in the vaccine? No, there is not. In fact, I was on a call one time, and that virologist answered that question and said, why would they even bother putting a microchip when they have your cell phone information? That's how they track you anyway. So anyway, again, to say that, no, this is a liquid, it's very small, there is no microchip in there, so nobody is tracking you. I think what got confusing to people is that they talked about how they track the shipments, and they're able to track the temperature. So that tracker is not in the vial itself, it's in the box. And the only reason that tracker is used to make sure, because with these vaccines, the temperature control is really important, because the mRNA is very delicate. It has to be kept at a cold temperature, otherwise it gets destroyed. Is that it's for them to be able to, one, make sure that they know where the vaccine is, and also that it gets there at the time that it should, and that also that the temperature is maintained throughout the transportation. And I think I forgot the last question that you asked.
No, I think you did cover everything. I do want to create a space. Is there anything that has not been asked or you need to have addressed for those of us that are joining us? And again, we'll circulate a link so you can get a recording of this and some of these resources and links, including the county flyer if you need it afterwards.
Dr. Kasirye, Dr. Kasirye, I know again, you don't have a magic ball and you don't have the answer to everything, but many of us in our jobs revolve around events, producing events, doing events. We know we can't do them. I think a lot of us are thinking perhaps at best in a different way, maybe September, October. Would you have any advice or counsel into us planning timelines? And again, I know you don't know what's going to happen in variants and all that, but should we really be looking at nothing this year and thinking about 2020 for events in a small scale?
It's probably safer to look at 2022, but we have been approached by some businesses that would like to start planning events. And for some of them, they're able to make modifications, and also with the knowledge that if things start going south, we may have to call you and say, sorry, but we have to pull this. And I know that's an unfortunate thing that nobody wants to have. But I think if you're able to put in the modifications with the social distancing, especially if you're able to make it a drive-through, or especially if you're able to do it where it's a large space and people are able to remain separated. I think there are some events that are looking at that. Also outdoors events. I know that there is one business, I can't remember which one it is, where they contacted us and they talked about some of the things they're doing to be able to start providing some entertainment, live entertainment with all of the precautions, and being able to have it outside, make sure that there are no crowds. So we have a team actually that reviews some of those applications, and we try to help you to see. And we did that a lot with especially the coming up with guidance for Christmas and trying to make sure that people were able to celebrate safely. So definitely we'd like to work with you. We also want to get to the point where people are able to enjoy some of these activities again, but we also want to make sure that it's done safely. So if you have an idea, please reach out to us. We work very closely with environmental management. We'll talk with you about your plan and see if it's something that could be modified and could have a tentative plan for, I think probably the earliest would be fall, but I would even consider doing any of these events. Some of the ones that tend to have crowds, I would say probably not. But with some modifications, I think we can have those discussions.
Thank you. Dr. Kasirye, I did actually miss the second part of that question. So Fred, I hope that got you a little feedback on timelines. And I think it also helped us on just, I know we are now in this world of projections based on the governor's revisions and guidance, and every day is a new day and we never know what's going to happen. I know we're waiting for Super Bowl, people congregating for Super Bowl. Are we going to see effects? But we do appreciate you trying to give us your best guess so that we can try and at least do a little planning ahead. So thank you for that. The follow-up question was, is there a rare blood disease that is tied to the vaccine?
Not to our knowledge, no. Again, because the way that the vaccine works, once it delivers the message, it self-destructs. So far, the only effects that we're aware of are the side effects that happen, and those happen because your body is actually starting, that it shows that your immune system is actually active and it's starting to make the antibodies. So people will have things like pain or heaviness at the injection site. And as I mentioned, some people do have some fatigue and fever, but those pass off. What we do look out for also, and when you go to get your vaccination, you will be asked to remain for at least 15 minutes, is the more severe at what we call adverse effects, where someone might have something that's more severe, such as passing out or some other reaction. So we have to have you monitored for that, and it's rare. We do have to watch out for it because there are some people who might have those reactions. So you will be asked questions like, have you ever had a bad reaction to a vaccine? Do you have any allergies that you're aware of? So those are the things that we watch out for, so that we can make sure that we keep you safe.
Well, Dr. Kasirye, just in this last minute, I want to create a space. Is that what again can we do for you or are there any asks you had this community that we can pass along? Because you are by all means have been a tireless advocate and leader in this space. We do incredibly appreciate the work you and your team are doing. We know that you do not get enough gratitude and thanks for the lives you're saving. So what can we do to help support you and your team?
Actually, I just want to thank you all, because I know I'm very aware of the impact that the business closures have had on people's lives. I think when I was asked, actually, some of the hardest times, apart from being able to listen to people and the how they've been impacted by COVID-19 and the deaths that have occurred in families, some of the hardest calls and emails I've had is from people telling me, I've worked in this business for 20 years and I'm going bankrupt. That's really, really hard. And it was not easy has not been easy for us to make these decisions, to ask people to keep their businesses closed. And I'm really hoping that this is behind us, or at least going behind us, as we get to the vaccinations. I do ask for your patience with the vaccine in terms of us being able to roll it out. We really want to make sure that we get it to everybody. I'm hoping that more vaccine will come out so that we don't have to do all of this prioritization, and you can just walk into a clinic or a pharmacy and get your vaccine at your convenience. But right now, if you do have questions, please feel free to reach out. We will work with you the best way that we can in terms of rolling this out. And as I mentioned, for the food industry, I think with the way things are going, our hope is that sometime in early March, we'll be able to start working on that. And we'll be looking to work with all of you to see the best way to be able to get vaccine to all of the workers. So thank you, everyone. And I'm hoping 2021 will be much better than the last year.
Well, thank you, Dr. Kasirye. And again, I want to thank all of you that have joined. I think for most of you, you know how to reach us at the Metro Chamber. If need be too, for your audiences and for anyone or your employees, if they have questions, they can also email us at covid19help@metrochamber.org. And if we don't have the answers or the links, we will make sure it gets to Dr. Kasirye's office and get some of those answers for you as quickly as possible. So again, Dr. Kasirye, we can't thank you enough. If we can be a resource, please come to us at any time. Even if it's just to get information out. We again appreciate all you're doing. And again, thank you to everyone for joining us today.
Thank you.
Thank you. Thank you, everyone. Appreciate it. Stay safe, stay healthy, enjoy your weekends, support our local businesses, and we look forward to seeing you again soon.
All right. Thank you.